Folks, if you receive prediabetes diagnosis, it means you have a higher than normal blood sugar level, but it is not high enough to qualify as a diagnosis of diabetes. According to a 2014 review, long-term data suggests that lifestyle changes may decrease the risk of prediabetes progressing to diabetes for as long as 10 years. An earlier study showed that 5 to 10% of people's prediabetes progresses to diabetes every year. Treating prediabetes can also be thought of as preventing type 2 diabetes. If a doctor gives you a diagnosis of prediabetes, they will recommend certain lifestyle changes. A study called the Diabetes Prevention Program showed an approximate 58% reduction of risk in people who kept up with these changes in the long term. Folks, the most common ways to manage prediabetes are keeping up a diet that is rich in fiber, exercising regularly, keeping up a moderate weight, taking medication if a doctor prescribed it. Some people with diabetes choose to use complementary and alternative medication treatments to manage their condition. Now, these treatments can include taking supplements, meditation, and acupuncture. Folks, always check with the doctor before starting any complementary and alternative medicine treatments because they may interact with your medication. Folks, research suggests that a low carbohydrate could help improve your blood glucose management, insulin resistance, and fat. Although most available research is focused on type 2 diabetes rather than prediabetes specifically, it may be fair to assume that a low carbohydrate diet could also be beneficial for those with prediabetes. Folks, low carbohydrate diets generally restrict your carbohydrate intake to less than 26% of total daily calories, or about 130 grams of carbohydrates per day. Talk with a doctor before making major changes to your diet. Let's talk about the complications. If you don't get treated, prediabetes can develop into type 2 diabetes and other conditions such as heart disease, stroke, nerve damage, kidney damage, eye damage, foot damage, folks, in which poor blood flow may lead to amputation, skin infections, trouble with hearing, and Alzheimer's disease. The good news is that prediabetes is reversible with long-term lifestyle changes. Let's talk about have more and have less. In have more, fish with omega-3 fatty acid such as salmon and tuna, vegetables, fruits, high fiber foods such as whole grains. In have less than 1500 mg of sodium per day, stop alcohol, foods with added sugar, and unhealthy fats. Folks, prediabetes is reversible. You can prevent or slow the development of prediabetes and diabetes by making lifestyle changes, including keeping up a moderate weight. According to one 2017 review, each 2.2 lbs of weight loss could lower the risk of type 2 diabetes by 16% for people with IGT or prediabetes. A heart-healthy lifestyle includes the following. Folks, here are the two very important ways to reverse your prediabetes. Number 1, eating nutrient-rich foods. Be sure to include plenty of nutrient-dense whole foods in your diet and limit your intake of highly processed foods and sugar-sweetened beverages. Fiber-rich foods such as fruits, vegetables, and whole grains can be especially beneficial to help you reach your health goals. Number 2, exercising. You can lower your risk of diabetes by regularly staying active. Doing 30 minutes of any activity that raises your heart rate to your target rate, such as walking, most days a week is recommended. Folks, here are the ways to incorporate physical activity in your daily schedule. Can include riding a bike to work, walking instead of riding the bus or driving, going to a gym, participating in recreational sports with a team. First, getting 30 minutes of exercise per day using losing 5% to 7% of your weight can lower your risk of type 2 diabetes progression by more than 58% according to CDC. To conclude the information, if left untreated, prediabetes can cause several health issues including type 2 diabetes, heart disease, and stroke. But it's reversible and can be treated by making lifestyle changes. In addition to following a health-promoting, well-rounded diet, getting regular physical activity and taking medications as prescribed by a doctor can help prevent prediabetes from progressing. Guys, if you found our information helpful, then consider subscribing our channel, like this video, share with your friends. Stay healthy and safe. See you in the next video.